I'm Nicoli, and I work for Manet Community Health Center, and I'm doing a Narcan demonstration today with one of our nurses, Rose Niles, who also is with Manet Community Health Center. Narcan is an opiate antagonist, which means it reverses the effect of an opiate overdose. So it can be used when someone is overdosing on an opiate, and it only works on an opiate. So some opiates are known as heroin, OxyContin, oxycodone, methadone, all of those different opiates, and it usually works within 1 to 3 hours after a person has gotten high. And the best thing that you want to do is to determine whether someone is high or not, or someone is overdosing. You need to be able to determine the difference between what we call really high and overdosing. If someone's really high, they're sitting in a chair. In some cases, they might be in what we call a heavy nod. The heavy nod is very, they'll be sitting there, their head is usually down, the chin is resting in their chest. You might want to tap the person and be like, hey, Warren, are you okay? And if you get a response to that, you know that they're in a heavy nod and that they're what we call really high. And you kind of want.
If you get a response to
If you get a response, because they'll be like, just leave me, they'll kind of like, they're still awake, they're alert a little bit. You want to, keep an eye on that person because they could go into an overdose. If you're not getting any response at all, the next thing you want to do is you want to get that person, you want to put them on the ground, on their back with their head up. If there's any body fluids coming, any vomit or anything like that, you do want to tilt the head back so that it drains out a little. The next thing you want to do is you want to do what we call a sternum rub. You want to take your hand like this and put your knuckles up like that, and you want to rub between their breastbone while they're flat on their back. And you just want to give it a nice little, a good little rub up and down. If they don't respond to that, it's a good determination that they're in an overdose.
If they respond to you, they still might be going into the overdose, they're just not in it yet. Which is,
correct. Okay. And that would be when you were tapping them on the shoulder. So if you're getting no response here, that's when you want to go to the sternum rub. So you've done the sternum rub, you've gotten no response whatsoever. So at that point you can determine that they're in an overdose. The next thing you want to do is you want to call 911. When you call 911, you want to tell them that you have somebody here who's not breathing, and you want to be able to make sure you can say to them, you know where you are. You want to give them the exact address and give them the correct information. And all you need to say to them is you have somebody here who's not breathing. If you have to leave the person who's overdosing alone in the room, you want to put them in a rescue position, which means you want to lie them on their side, and their leg that is on top, you want to bend that leg so that they can't rock. Because you don't want them to rock on their back while you're out of the room, and you don't want them to rock on their face while they're out of the room. So you want to keep them in what we call that rescue position. Again, they're laying on their side, and in that way they won't rock. You've done the sternum rub, you've called 911, and you've told them that you have somebody here who's not breathing. If you say an overdose, they're going to ask you some questions that they can get those answers to. So the best thing is to just say, I have somebody here who's not breathing. So just to repeat the steps at this point, you've done that. You've determined that they're in an overdose by doing the sternum rub. So the next thing is you've called 911 and you've left the person in a rescue position. 911 is now on their way, so you want to go back to the person who's overdosing, and you want to lay them on their back, and you want to do rescue breathing. The reason for the rescue breathing is so that you can keep their oxygen flowing. And rescue breathing, you want to do 2 breaths every 5 seconds.
Would you use some kind of protection?
Yep. The best protection is you can use a t-shirt. So the person who's overdosing, you can lift their t-shirt up over their stomach and just rest it over their mouth here. Obviously you want to keep their nose open. And you want to just use you can use that t-shirt as a barrier. And it really works as a great barrier.
And you'd watch for the chest rise?
And you want to watch the chest rise and fall. Okay. So when you do your first breath, you want to look and see the chest rise fall. If you're not seeing that, you want to tilt their head back a little bit more. You want to get a nice clear airway that you can do that. You want to do this for a couple of minutes. You're going to get very tired doing this, so you're not going to be doing this for a long period of time. But again, it's to kind of get the blood flowing and to keep things moving along the best you can. Because remember, in an opiate overdose, the person's not breathing.
The respirations go way down.
Exactly. So the next thing you want to do, so you've done the rescue breathing and there's no response to the rescue breathing. So now you want to administer the Narcan. And I'm going to show you how to put Narcan together and then how we administer that. So the best way to do Narcan, so when you get a Narcan kit, your kit's going to look like this. It has 2 doses in it. In the box, we have the Luber syringe, which is this piece here. And then we have this tube here, which is the actual Narcan. This is actually what's inside the orange boxes. This is the atomizer. This is the actual Narcan. And this is how the Narcan is going to be administered. They call this a syringe, actually. So inside the box, so each box is going to look, this is what's inside the box, and then these are wrapped separately. So when you open the box of Narcan, what you're going to do is you're going to have these 2 pieces in here. And this is a really easy way to assemble these. You want to pop off the bottom yellow here, and you want to pop off the top of the Narcan. In most cases, it's usually purple. So you just want to pop this piece off here. And what you're going to do is you're going to come into the bottom here with this, and you're going to just push it in, and you're going to give it a nice little twist. And it'll stay in just like that, okay? Then what you want to do is you want to pop off this top piece here, and you want to put on the atomizer. And what you do is you push it right here on the top, and you give it a little bit of a turn like that, and it stays in just like that.
Is that real?
And that's what it looks like together. When you administer it, what you're going to do is you're going to, it's sprayed, it's a mist. You're going to spray half up one side, and you're going to spray half up the other side. So when you spray it, as you can see here, it comes up as a mist. Very, very hard to see on the camera, but it comes up as a mist just like that. This is just water. This just happens to just be water. This is not Narcan. These are the kits that we use to demonstrate to folks. So again, it's half up one side and half up the other. Once this has been administered, it usually takes 1 to 3 minutes for it to work. So
Get away.
and what you want to do is when you administer it to somebody, you want to kind of back up a little bit because they may come up aggressively. And they're also, one of the things you got to remember is that what this does is this actually takes away their high. So they're no longer high at this point. And you want to just kind of back away and let them kind of come out of it a little bit. By the time, if you've administered the first kit and nothing has happened within that 1 to 3 minutes, go ahead and administer the second kit because you always get 2 kits. You always get 2 doses in every kit. So you would give it the 1 to 3 minutes, and then you want to go ahead and administer the second kit. By the time you've administered the second kit, if nothing has happened, most cases the first responders are on scene, and then they can take over. No, you always want to call 911. You always want to make that part. Everything that I just said, you want to do the sternum rub, to the rescue breathing, to rescue position, to calling 911. That's you really, and again, you want to follow it. Again, sternum rub, 911, rescue position, rescue breathing, Narcan.
Well, when the Narcan runs out, they can go back into the overdose, which is...
Well, yeah, that's why we want you to go. It's important that they go to the hospital and let the emergency room take over. So.